Sorry about that. My mum likes to interrupt sometimes. So what was I speaking about? My incisions. They look really, really good. They're not raised, so I'm really, really happy about that. So what they did, the nurse cut off the knots on my stitches. I have dissolvable stitches because I couldn't deal with them taking out stitches. That would just kill me. Yeah, so she cut off the knots with them, so I guess they dissolve fully. Then she suggested to me, because I asked my surgeon about whether I could get silicone strips. She said don't do that, or he said don't do that, because they move around a lot and they're not going to be the best for me because of my skin colour. Because I think I explained in one of my first videos, and it's not a racist thing at all, but black skin heals differently to any other kind of skin, which is a little bit annoying, and we have a higher risk of I think it's called keloid scarring, which I'm praying that I don't get, but he said by looking at my skin he doesn't think I will. So he suggests to me to do the silicone gel instead, and I asked him whether it's okay to start now, 1 week after my surgery. He said no. He said to wait a little bit, about maybe 2 or 3 weeks, and then I can start using it, but I have to wait till it's not scabby, so it's not hard, but it's quite shiny and pink. That's when I can start to use the silicone gel to help heal my my scarring. So I will definitely use that. I'm trying to think, what else did he say? I asked him about my cleavage, because right now, I don't know if you can see properly, but my boobs are quite far apart, and I was expecting to just have the line. And he said because the implant has gone underneath the muscle, that I have a risk of having quite a bit of a gap between my boobs, which I don't really mind, because as long as my boobs were bigger than what they were before, I'm going to be ecstatic anyway. So he said I do have a risk of that, but he looked at my before pictures and he saw that my cleavage is, the gap is quite little. So he said that I should be okay, and that when they drop, then he'll really be able to see exactly what they're going to be like. But he said that he thinks I'll have a good cleavage, which is a score. I'm trying to think of anything else. Yes, he said, I asked him whether I need to massage my breasts to help them go down, or to help them heal better, and he says I don't have to, because I had seen a lot of videos previously of other women massaging their breasts to bring them down. He said just let nature do its job and they will go down the way they're supposed to. So I have been leaving them alone and I haven't touched them, and I don't intend to touch them because that's what he said. So that's what I'm going to do. So that's pretty much the post-op appointment that I had. Oh, and I also got this band. Can I reach? Oh, sorry. I got this band, this evil, evil band. I'm not sure if I can separate it because it's got Velcro. So I got the small size. It is light brown, and it's got Velcro right here. I meant to wear it really, really tight across the top of my breasts all the way around, and they're supposed to help bring my breasts down faster. It's not very nice to wear, not because of the Velcro, but just the feeling, because they are really pushing down my boobs this time, way more than any tight sports bra that I've worn. So that's not very comfortable. So I think I'll wear it in the day when I'm at home, but when I'm out, I think I'll give myself a little bit of a break, because it really isn't very nice at all. So I'll wear it most of the time, of course, but when I feel that I can get away with not wearing it, even if it's just for an hour, I think I'm going to do that. What else? Yeah, so that is my post-op, but I have another really important thing to talk about, a really big discovery. So when I had my when I had my boobs done, my breast augmentation, I lost feeling completely. Ow, that's so weird. As soon as I start speaking about it, it comes. Sorry. As soon as I had my operation, I lost feeling completely in my nipples. Like, I'd put ice on them, I would rub them, I cannot feel a thing. Like, I tried closing my eyes and see if I could feel them then, but nothing happened at all, which I found really, really weird. But I've done my research before I did my breast augmentation, before I had my surgery, and I knew that I could lose sensitivity in my nipples for a while. So they have decided to come back, and it's probably the second worst pain that I've ever felt, apart from my tattoo that I have on my spine. It is the worst pain I've ever felt. Worse than the swelling, worse than feeling my boobs drop. It is awful. It feels like, I've got it now, it's literally it's all in my left boob. For some reason my left boob decides to attack me. It feels like, if you imagine a pin prick, like on your skin, just but imagine it coming from the inside and it's poking out like from the inside of you. It feels like that, plus getting an electric shock now and again. It is dreadful. I did say before that I'm not going to sugarcoat anything, and I'm not. It is awful. I'm walking around central London, I guess trying to do something with my day, so I'm not just sitting indoors, and I keep grabbing my boob like this, trying to help myself, and all the guys are looking at me thinking that I'm trying to instigate something with them, and I'm definitely not. That's just not me. And because it hurts so bad, I've had to take, because I told you before that I hate to take tablets, I had to take my painkillers today and yesterday because it was dreadful. It just like right in my my left nipple. It is not nice. I'm letting you girls know from now that when your nipples do get back to being nipples, it is not fun. You're gonna be very, very irritated, and I am, because I just want to walk around as normal, and there's just this bloody pain in my nipple, and I can't even grab it because everyone's gonna think that I'm a pervert, which is really weird. So one thing I did try, because to stop my nipple rubbing on my sports bra or any of my clothing, is that I use like a cotton wool pad. I don't know if I have them here. Wait, I think I do. Ta-da! Cotton wool pad. I literally place it right there inside by my nipple to stop it rubbing, and just to give me a little bit of pain relief. That works a little bit, but I still had to take my painkillers because it just wasn't happening. And when I'm at home, I just put my big pack of frozen peas over my boob just to calm it down, because it's just a mess. This is probably the worst. It's the worst part so far of my journey of getting my boobs done. It is dreadful, but I wanted to let you guys know that because it has shocked me for the past 2 days, and I'm just hoping and praying that it goes tomorrow because I'm so bored. It is so boring, and I'm just done. Apart from that, I don't feel any pain. Everything is fine. Everything is flowers and roses and sunshine. Everything is great apart from my nipples. So please, if you do think about me, if you do watch this video, please pray for my nipples. Please just smile for my nipples, or send some good energy to my nipples so they just stop, because I just can't. So yeah, that is the end of my nipple story. I'm trying to think if I have any more things to say. Right now, currently, you can't really... my nipples. You can't really see in this sports bra. But my right boob is definitely more swollen and bigger than my left. I know that naturally one boob is supposed to be bigger than the other, and that's all good, but right now there is a bit of a difference, and I think because I'm left-handed, and I naturally use my left hand way more than my right, so I think my left breast is healing faster. So I'm going to try and do a lot more things in my right hand to see if it makes a difference. I think it will. But either way, they're pretty much the same size. I just noticed because obviously I look at my boobs pretty much every day. So that's why I can see that. But I'm going to try using my right hand a little bit more and see if that helps. But apart from that, I think that is all I have to speak about. I think it is. So my next update is going to be my 2-week update. Hopefully my nipples will stop. I hope it just doesn't move on to the right one because I don't think I can cope. So I'm praying that my nipples will stop. I'll let you know about any swelling. I didn't get time to show you the incisions, but I will next week. And I'll also put on the bikini so you can see my boobs 2 weeks after my operation. Yeah, I think that's it. So yeah, thank you for tuning in. Thank you for watching. I hope I've been more informative this time and not too scatty as sometimes I am. Please subscribe to my channel. I always try and inspire people and try and give people all the information that they can. So yeah, I hope you have a really good day or a really good night wherever you are in the world, and I will see you in a week. Alright, see you later, loves.